Hola y muy buenos días a todos. Gracias.
Hello and good morning, everyone, and thank you for joining us in this virtual press briefing on the COVID-19 pandemic in the Americas. I'm Sebastián Oliel from the Communications Department at Paho, and this session will be between 45 minutes and an hour, just like as every week, and we will be taking questions from you up to that point. Please remember that on the Paho's website, www.paho.org/coronavirus. You may find updated information on the pandemic as well as our latest updates on deaths and cases in the countries in the region. This session will have simultaneous interpretation into English and into Spanish, and you can choose your language by clicking on the interpretation button. As usual, we have already received some questions via email, and you will be able to ask questions using the Q&A button in the chat room. As usual, please include your name and media outlet. Today, Paho Director Dr. Carissa Etienne will give you an update on the pandemic in the region, and we'll talk about access to a future vaccine against COVID-19. She is joined by Dr. Harbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies at PAHO, Dr. Marcos Espinal, Director of the Department of Communicable Diseases at PAHO, and Dr. Silvan Alighieri, Assistant Director to PAHO and Incident Manager for COVID-19. I would now like to ask Dr. Carissa Etienne for her opening
Thank you,
remarks. Dr.
Sebastian.
Etienne, you have the floor.
Good morning. Thank you for joining today's briefing. As of July 13th, we have reached 6.8 million cases and 288,000 deaths across the region of the Americas. This equates to roughly half of all cases and deaths reported around the world. In the past week, our region has reported 60% of all new cases and 64% of all new deaths in the world. Since our last briefing, we witnessed another record-breaking week as regional hotspots like the US reported their highest ever daily case counts. The number of people dying of COVID-19 is also climbing, particularly in Brazil, Mexico, and the United States of America, reporting some 77% of all the deaths over the last week and currently experiencing some of the deadliest outbreaks in the world. The most vulnerable populations have been hit the hardest. In Brazil, for instance, indigenous communities along the Amazon basin are seeing incidence rates more than 5 times the national average. Over the past months, we have used the tools at our disposal. Around the region, many schools and airports were closed, several cities restricted movement, and public gatherings were canceled. These strategies worked to flatten the curve, to limit mortality, and to protect health systems. Individuals practiced social distancing, hand washing, and sanitizing, and wore masks. We must continue to pursue appropriate public health measures that are proven to slow the spread of the virus. At the same time, we must also plan for the arrival of new tools that could transform our response to COVID-19. Although effective medicines or vaccines are likely many months away, it is critical that we work today to ensure equal access to these life-saving tools when they become available, and that we develop a strategy for delivering them quickly and safely. The last few months have ushered unprecedented collaboration among scientists, governments, and global partners to develop coronavirus treatments and vaccines in record time. Today, there are more than 150 vaccine candidates in the pipeline, and more than 20 of these are already being tested on volunteers, with active participation of countries in our region, such as the United States of America, Canada, Brazil, and Argentina. It is important that Latin America and the Caribbean join these clinical trials so we can participate in this global effort to accelerate the development of vaccines that are safe and effective for everyone. However, countries should only participate if it is done right, with the adoption of proper regulatory, technical, and ethical measures. Paho is actively engaged with our member states and their national regulatory authorities to provide technical cooperation on all important matters regarding clinical trials as they participate in these urgent endeavors. We know that developing the vaccine is only half of the challenge. After all, what good is a vaccine unless people can access it? The Paho Revolving Fund for Vaccines has a strategic role to play in the access to a vaccine for COVID-19. This is unique for the Americas, which is the only region with a shared mechanism for purchasing and delivering vaccines. For the past 35 years, through the Paho Revolving Fund, countries have pooled their resources to purchase high-quality, life-saving vaccines at lower prices. More than 41 countries and territories across our region have used this mechanism to purchase vaccines for their national immunization programs. Through this fund, we have vaccinated generations of children, helping us to become the first global region to eliminate polio and the only region to have eliminated measles, mumps, and rubella. Today, we have some of the highest immunization rates around the world and have facilitated the swift introduction of new vaccines. This is remarkable, especially considering the diversity and inequities that persist in the Americas. In the spirit of regional cooperation, we are supporting Latin America and Caribbean countries to join a landmark collaboration to accelerate the development, production, and distribution of future COVID-19 vaccines. Housed under WHO's Access to COVID-19 Tools Accelerator, the COVAX facility is grounded in the same principles of our revolving fund: shared resources and equitable access at affordable prices. The facility will negotiate on behalf of many countries worldwide with the producers of all promising COVID-19 vaccine candidates. This will enable countries, regardless of their income level, to secure better prices and assume less risk than if they negotiate individually. No country should do this alone, especially since we improve our chances of success and reduce competition if we work together. The COVAX facility is the best option to guarantee equitable access through fair allocation across countries and to reduce the risk of having no supply if a specific vaccine candidate fails. Paho has been actively involved in the COVAX facility negotiations and is working to secure the best possible conditions for the countries in our region. This includes having our member states from Latin America and the Caribbean join the COVAX facility through our revolving fund. Acting as a bloc, Paho member states will benefit from our technical expertise as well as our decades of experience securing and distributing vaccines quickly and efficiently. We will also ensure the process is as inclusive as possible by allocating doses fairly among those countries participating. Paho will work with our member states to establish the best immunization strategies and to strengthen and adapt the systems that may be required to deliver these novel vaccines. Together, we will focus on protecting those most at risk, health workers, the elderly, and people with comorbidities. Paho is also coordinated with Gavi and other partners to guarantee that the most vulnerable countries in our region receive the vaccine against COVID-19 in a subsidized manner and at an affordable price. We already have 30 countries and territories joining the facility through Paho's revolving fund, and we are excited to see more expressions of interest from our member states in the coming days. The more countries that join, the stronger we will be. The virus has redefined how we perceive time. In a few short months, it has transformed our way of life, our region, and our economies. We must look ahead to plan how we will select, manufacture, pay for, and distribute a vaccine. We need to improve our regulatory capacities on immunization, build vaccine post-marketing surveillance, boost vaccination programs, and improve or adapt our cold chain facilities. And we must work now to strengthen our capacity that will allow us to reach our vulnerable communities once we find a successful vaccine. If not, it may take years for people to be vaccinated for COVID-19, and we can't afford that delay. We must seize this moment and work together towards a future where everyone, regardless of who they are or where they live, can receive life-saving COVID-19 vaccines. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. And now we're going to move on to the questions that we have received via email, and then we will move on to the questions that we will receive via chat. And you can ask your questions using the Q&A button. Please identify yourself with your name and media outlet. And we will also give you the floor so you can ask your questions live. And for that, also, please send your questions via the Q&A button and raise your hand so we can coordinate all the questions. The first question says,
Talked about a new vaccine for COVID-19, but how is the current immunization coverage in the region with the pandemic? Dr. Etienne?
Thank you, Sebastian, and thank you for this question. Paho has been following the situation in our countries these past months. And yes, we have seen how COVID-19 impacted our immunization programs, interrupting our vaccine supply routes, reducing the availability of health workers to deliver immunizations, and hindering access to primary care services. Paho has a long tradition of working alongside countries to improve immunization coverage, from encouraging commitment to vaccination programs to technical assistance and the tools to improve coverage, supporting communication strategies, and reinforcing the cold chain. Through the revolving fund, which we mentioned earlier, we pool resources to purchase vaccines from member states in an effort to expand access, to guarantee quality, and to secure better prices. We have been encouraged that 14 countries in our region will immunize 90 million people against the seasonal influenza. And as of today, more than 78 million have already been vaccinated. Paho is helping countries secure the necessary doses of vaccine to reach this goal. It is important that we find safe ways to deliver vaccines during the pandemic. Many countries have embraced innovative approaches and methods for immunization that minimizes the risk of COVID-19. Until a vaccine for COVID-19 is available, Immunizations should be delivered by the health services alongside the response to COVID 19. We need to maintain our immunization coverages. If we allow large gaps in immunization coverage, vaccine preventable diseases can reemerge, and all our efforts in the past decades to eliminate diseases could be in jeopardy. Maintaining a robust capacity to deliver vaccines will be essential for when we have an effective vaccine against COVID 19, when we will rely on these same systems, the same healthcare workers, and the same policies to reach those at risk. Thank you.
Muchas gracias, doctora Etienne. La siguiente
Thank you very much, Dr. Etienne. And the next question we received comes from listener from CNN. And the question is,
in the last few weeks in infections by age groups across the region? Dr. Barbosa?
Thank you for the question. No, we haven't had any important changes in the distribution of cases of COVID-19 by age group in the region. The age group that concentrate the bigger number of cases is 30 to 30-90. But when we look to the deaths, most deaths are occurring in people over 70. So this is a similar demography of the cases that we have seen in the last 2 or 3 months. No changes, no important changes at all. Thank you.
Gracias, Dr. Barbosa.
Thank you, Dr. Barbosa. And the next question is from Guillermo Garcia Vallesca from EFE. And he says that yesterday different media outlets ensured, quoting Paho, that Latin America is the second most widely affected region by the pandemic in the world. Could you please confirm whether this is true? And if so, could you please disclose the factors that have made this region more vulnerable to the virus compared to other regions in the world? Dr. Espinal? Yes, thank you for that question. Well, if we compare Latin America with other regions, our region has already surpassed others, and North America is only trailing Europe. Europe has reported about 200,000 deaths. So Latin America is, in fact, the second highest. Of course, when we see the region as a whole, the Americas as a whole, pretty much we could say we are the epicenter because it concentrates about half of the cases and half of the deaths. So the continent as a whole is number one. Now, the conditions in Latin America are varied. Our high inequality rate, which was mentioned by the director, mean that we are facing an economic, a social, and a public health issue. So it's not just the inequalities, but also our health services with their strengths and weaknesses, of course. The informal economy that prevails in some of our countries, which has made many of them reopen their economies early with the resulting rebound in cases that have affected our population. So all in all, we have to be very careful in continuing with our mitigation measures and monitoring our hospital beds, do widespread testing, social distancing, educating our population, etc. Because we need to prevent having more deaths and more cases in Latin America. Thank you. Thank you, doctor. The next question is from Jimala Mitchell Pullen from Jamaica, and it says,
is Paho satisfied with the measures taken by the government of Jamaica in the fight against COVID-19? If not, what areas can it improve on? Dr. Aldieri?
Thank you for this question from Jamaica. We have a mosaic of transmission of patterns of dynamics of the COVID-19 in the region of the Americas, including in the Caribbean. Some countries of the Caribbean have not experienced detected cases for a long time, for weeks after closing their airspace. And some countries are experiencing some reimportation following the reopening and of the airspace and the resuming of non-essential travels, international travels. Regarding Jamaica, we have noted during the last month a very strong response in terms of contact tracing, and the country has been able to control the clusters that followed the importation of the first cases now a month ago. But more generally, regarding the Caribbean islands, I think it's important to note at this moment this notion of risk assessment and risk management. As countries that are mostly tourism-dependent countries are reopening their airspace to non-essential travel, we are aware of health screenings that are implemented by member states. And I'd like to flag some important aspects. This notion of risk assessment and also risk management. There is a risk in terms of resuming non-essential travel, and it's important to monitor what is happening in the country of origin. So the national authorities can have an idea of the community transmission and the sustained community transmission in some areas and take appropriate decision. It is also important to manage the sense of false security that would be given by testing and negative testing. First, we are talking only about molecular testing. This is what Paho and WHO are recommended. Antibody testing for COVID-19 is not reliable. But even with PCR testing in good conditions, we have to be very careful on using these criteria for non-essential travel. Because if a person is tested negative 2 to 3 days before traveling, it doesn't mean that this person cannot be reinfected in an area where there is a sustained transmission. And also, a PCR test would not detect the virus during 1 to 3 days after the infection. And finally, the last point that I'd like to flag is that the national authorities must be in a position to locate the international travelers when they are in their country. I hope that I answer the concern from the journalists in Jamaica. Over.
Gracias, doctor. La próxima pregunta nos llegó de
Thank
Oscar.
you, Doctor. The next question is from Oscar Garcia from Prensa Libre in Guatemala. And it says, how can we face a pandemic in rural areas such as Guatemala where access to health is limited? And according to forecasts, infections will increase in these areas. He goes on to say whether we have data regarding whether reopening is working. Dr. Ugarte, could you answer this question, please? Of course, and thank you, Oscar, for your question. Rural areas in general have access to health services, first year health services where primary care is implemented. So, in that sense, it is very important for that primary care service to have the necessary capabilities to detect cases in time. And with that, transfer or refer patients to the health services that they may require according to the severity of their condition. This aspect is key in all countries because, like you very well know, the large majority of patients that have COVID 19 have either few symptoms or mild symptoms. However, in order to protect lives, we need that patient referral network to be working properly. In the case of Guatemala, we know that the status of the disease is is such that there's an increase of cases in urban areas where there's high community transmission with a lot of daily reported cases, and where there is an increase in demand for health services. And that demand for health services and that saturation of health services also, of course, impact rural services that are less likely to refer their patients. However, it's important to point out that in the several other areas of Guatemala, included areas that are not urban, that is to say rural, the proportion of cases is much lower and the situation is less severe. So we need to implement protection measures, prevention measures in those areas. That is the best approach to face this pandemic. So, wearing masks, social distancing, and other prevention measures are key in rural areas, because in urban areas where they have the health centers that will be seeing um, patients that are in a severe condition are close to saturation levels. Now, in terms of reopening, many countries that have reopened their economies without having thoroughly assessed their situation are seeing an increase in cases, like Madam Director said and other colleagues echoed. Therefore, they need to do a specific risk assessment by area and have adequate surveillance to adjust those measures according to what available data show. Thank you. Thank you, doctor. And now I would like to give the floor to Jacinta Molina from CNN Chile so she can ask her question live. Jacinta, if you're hearing, you can ask your question. Yes, thank you very much for this opportunity. Could you please elaborate on the response regarding some of the aspects that were asked about regarding the pandemic, the impact the pandemic has had in the Americas? I know Dr. Espinal already alluded to this, but could you expand a little bit on that response? Because these vulnerability factors are also present in other regions, overcrowding, health services such as Africa. But even so, the pandemic has hit Latin America the hardest, to the point that we have become the epicenter. So, specifically, why has that been the case, and what local factors from our Latin reality have made the impact so harsh? Thank you, Jacinta. Dr. Espinal, could you please elaborate a little bit more then? Yes, thank you, Jacinta, of course. Let us remember that Latin America is the region in the world that has the highest inequalities. Africa has certain differences with Latin America. Africa is the poorest region in the world, but Africa also has vast land and areas that are very weakly populated. It doesn't have the large cities that Latin America has, that have a major city surrounded by the metropolitan area and slums and population groups that are highly vulnerable. They do not either have those vulnerable groups that are in this like almost marginalized situation, such as indigenous peoples. So basically, we don't find a Rio de Janeiro or a Sao Paulo or a Mexico City or a Santo Domingo in Africa. Well, of course, we do have some, like in South Africa, but those are some of the differences. In addition to that, Africa does not have the same level of trade, travel, and air travel that Latin America has. Let us remember tourism in Latin America. There are some major differences. So Africa is not exempt from being succumbing to the pandemic. We see the cases increasing, but the the virus came in stages, first in Asia, then Europe, and now Latin America. But we're yet to see what the impact in Africa might be. It might be a very harsh impact, and this is far from over, and we're going to have to get used to living with this new normal because we're still learning on the go about this virus. Thank you very much.
Doctor, vamos a pasar a la
Thank you,
siguiente
Doctor. We're going to go into the next question, a question that comes from Javier Verdejo from Radio Santa Maria, Chile. It says, he would like to ask about the specific situation in Chile. He says the slight improvement shown in recent weeks in Chile with a decrease in contagion. Does that justify applying a lifting of the lockdown or reopening businesses? And what is the reaction or the recommendations of Paho? Dr. Barbosa, please. That's a very good question. In Chile and all the countries of Latin America, it's very important to monitor the situation in each state or in each region, department, or municipality, because behind averages in countries, there are very different dynamics in the countries. There are cities, municipalities that have been able to control the disease. In other cases, the spread is actually going up. So it's very important to do monitoring, just as Chile is doing, and to take any measure to open up the economy only after there is certainty regarding the transmission. Now, in Chile, in recent days, we have seen that the trend is downward in the number of cases and hospitalizations, but that is something that is going to have to be looked at to see how it is developing in each site. So first of all, we have to control transmission, reducing transmission, and thus not only flattening the curve, but look at the measures being implemented and increasing testing so as to slow down the speed of transmission, and after that, plan to reopen business. Thank you. Thank you, Doctor. The next question comes from Pablo Dupaz, Humanitaria, and Lopez from La Prensa, Nicaragua. So in English,
what is the current situation regarding COVID-19 in Nicaragua? Has Paho been able to interact with Managua in recent weeks regarding the state of the pandemic? Y Lidia López de La Prensa.
Lidia Lopez from La Prensa says Nicaragua, in contrast to Costa Rica, Honduras, and El Salvador, where there has been an increase in cases, is apparently quiet. The pandemic in Nicaragua is apparently quiet. And the question is, what would you say regarding this situation, although the government has not taken any strict measures to contain the crisis? Dr. Ugarte, please. You may be muted, Doctor.
Sorry for that. Thank you. Nicaragua provides succinct information regarding the pandemic in the country, and on a weekly basis, on the number of cases, number of deaths, the people that are recovered. We have not received detailed information as established by the international health regulations to date. So as a result, we cannot assess what is the current situation in Nicaragua regarding the pandemic, but there is, of course, this information is not only important for the neighboring countries and the international community, it is extremely important for their own population, because they need to know in order to implement the protective measures and others. Paho welcomes that the national authorities of Nicaragua are now calling for virtual meetings and celebrations instead of mass gatherings. And we hope that this and other public health measures are implemented are implemented in order to reduce the transmission and save lives in Nicaragua. And because this information is not properly shared, it may seem that the situation is not as harsh as in other countries. We have to look at what is the number of cases, what is the situation of the health services, the number of deaths that we see, and we will probably, when that information is available, we will value what was the impact of that approach. We see in other regions, in the case of Sweden, for example, what has been the impact of a similar approach. And there is a stark difference between Sweden and other countries that share the same conditions as Sweden. So lessons have been learned, and I think this should inform how the countries and the national authorities should approach this situation. And also regarding the healthcare workers, we have been very clear that we must protect the healthcare workers in Nicaragua and also in other countries. Healthcare workers are our first line of defense. They are putting their lives at risk. And if they do not have the proper protective personal equipment, but also if they are protected from being harassed or fired because of their concern that are shared around the COVID-19, we will be putting the healthcare workers in more difficult situation. So that is something that we highlighted once, and we would like to reiterate that call for Nicaragua and all other countries as well. Thank you.
Gracias, doctor. Siguientes preguntas.
Thank you, doctor. Now we have some more questions coming from Daniel Collin from TN 23 in Guatemala, and also from Cherson Collave from El Comercio, Peru. And this has to, in the case of Guatemala, we will be using ivermectin to treat COVID-19. What is your opinion on that? And Chelson from El Comercio says, what is the position of Paho regarding the decision of some countries to continue to use things like ivermectin and hydroxychloroquine to treat COVID when scientific evidence does not support these treatments? Dr. Iridiu, please, would you take these questions? Well, there are several questions here and they come from different sources. Thank you. The most important thing to highlight, and this is something that we did in the press briefings of past weeks, is that right now there really isn't an approved or validated treatment for COVID-19. In the case of ivermectin, Paho is not recommending the use of ivermectin for COVID-19, and the same applies for the World Health Organization. Ivermectin is a treatment. It is an anti-parasite medication that is used for veterinary medicine, but also we know that it has a good impact in campaigns to eliminate tropical diseases like onchocerciasis. But Paho, in some cases, has been alerted to the use of veterinary formulations on human beings when we talk about ivermectin. And that is something that can entail very serious consequences. Paho's recommendation applies to ivermectin. It has to do with hydrochloroquine too, and that is that all medications, and there are more than 200 molecules or combinations of molecules that are being tested right now. The recommendation is that this has to undergo random clinical trials with very close supervision of the medical corps, and that those findings need to be published following proven methodologies. Regarding hydroxychloroquine, I would like to emphasize that WHO stopped the inclusion of this product to treat new cases, and consequently, it is not recommending the use of hydroxychloroquine. Thank you. Thank you very much, Doctor. We have several questions from Mexico. The first question comes from Maria Versa from AP. She says, in Mexico and in other federal states, it seems that there is greater tension between the federal government and the states as they face the pandemic. How do you think this situation is affecting management of the pandemic? Dr. Barbosa. Thank you. Thank you for that question. In federal states, it's very important to get good coordination amongst all levels of government, the local, the state, the provincial governments, along with the national government. And this is very important because we are facing the largest public health challenge in this century. So there are a lot of doubts, and all the sectors of the economy, everyone has uncertainty regarding the future. So it's important to have a good, well-coordinated message as part of our response. The dialogue amongst all authorities so that everyone will follow the recommendations that are based on scientific evidence, so as to formulate the best public health recommendations. All of that is very important to assure that societies, that individuals, that families receive information and that they be well informed on what is happening, and so that they can see that the government as a whole is responding appropriately. Thank you, Doctor. The next question comes from André Pauté from Reuters. And the question is,
few COVID-19 confirmed cases. What are the factors? Do you think Haiti was ready to reopen borders and airports? What measures should they implement in this country? Doctor Ugarte, ¿podría tomar esta pregunta?
Thank you, Andre. The situation in Haiti has been, of course, a challenging situation because of the capacity of the health services and also the laboratory system to detect cases. But they have increased their capacity to test and they also detect the cases. They also increased their capacity of the health services to provide health care, including intensive care units and so on, that was expanded. The number of those beds that are occupied right now are not at the level that in other countries that have widespread community transmission. And we also saw that the countries that do have less international travel and connections have been less affected by other countries in comparison. Still, there is a significant increase of cases inside Haiti, and that increase is still going up. And the number of confirmed cases will most probably be higher in the coming weeks. And at this moment, there is no known reason what has happened with the situation, because most of the models and also the analysis that were done in previous weeks shown that the Haiti must be facing a very daring situation by now. We are considering that according to the situation of Haiti, reopening the economy is something that must be put in balance, as was said also by the director, Dr. Jarvas, Marcos, and Silvan. We need to be very careful on the adjustment of opening international travel, but also opening the economy. This is, of course, something that in Haiti cannot survive without an economy that is moving. At the same time, we need to emphasize that early detection, isolation, and quarantine that are very difficult to implement in Haiti must be also considered when we are following those measures. Over.
Gracias, doctor.
Thank you, Doctor. The next question comes from Jose Maria Costa from Diario La Nación, Argentina. And it says, in Latin America, the virus is active. in the summertime, in the northern hemisphere, in the winter here in the southern hemisphere. Do you think that the virus has gained strength since it hit the Americas? Dr. Aldiguieri, would you please answer that question? Thank you, Sebastian, for that question. As we explained a while back, we have a whole mosaic of transmission profiles in the hemisphere. Very few countries right now show a downward trend. So the surveillance has been very precise in molecular terms. 18 countries in the region are contributing to genomic surveillance. That means that they are sequencing the virus that is circulating right now. And today, although there are differences in lineage, we have not detected any genomic changes that would mean that the virus is more or less severe. What we are seeing is we're seeing an upward trend despite public health measures. And this includes massive events, large crowds, and we know that large crowds provide for greater transmission. Thank you, Doctor. We have several questions, in this case from Pablo Hernandez Mares from medscape.com, asking, what is Paho's message to the people that hold family gatherings or parties now that contagion has increased? And also Paulina Alcazar from Imperante News, Mexico, asks, what would be the most successful measures to encourage people's behavior when they go outside of their houses? It's easy to answer that question. Avoid parties, crowded events. We all have relatives, we have our grandparents, our parents, and as we know, these people are at greater risk. Now, people with cardiovascular disease are also at risk. So it's not only a matter of you're getting sick, but you can transmit the disease to your relatives. So right now, in the time that we're in, you have to avoid parties, you have to avoid mass gatherings that aren't absolutely necessary. And if you do need to have a group meeting because of your job, because of your relatives, but not a party, you can have a birthday party that's virtual. You can have a happy hour over your computer, but do not meet physically. If it's a small gathering, you have to use social distancing, you have to wear a mask, you have to be washing your hands. But the whole idea is to avoid crowding, large gatherings, because we have seen that those gatherings increase the spread of the virus. And the best thing is to educate our population, implementing the recommendations and that package of measures, because it's everybody. It's not only the government, it's the population. We have to be washing our hands, keeping distance, and all of that within the possibilities, within what the realm of what is possible. Thank you. Another question from Mexico, from Blanca Valadez, from Milenio. What is the opinion of Paho regarding the high mortality in Mexico? And apparently the mortality is higher in public hospitals and lower in highly specialized hospitals. Dr. Barbosa, please. Thank you for the question. Now, mortality rates in different hospitals and this applies to Mexico and all the countries in the region, reflect the facility of access to services. In other words, those that come in earliest, especially those people who may have some risk factor. That would be the elderly, people with hypertension, diabetes. Sometimes they come to the hospital too late, and their part of their lungs have already been compromised. And this is a situation that leads to a higher death rate. So ease of access is very important, but also the quality of care be given. It's very important that every hospital, that every health authority in Mexico, in every country of Latin America, it's important that they examine their data, looking at mortality rates in each hospital and see how they can adapt training protocols to train their healthcare staff so that everyone with COVID-19 will receive the best possible care. We know that there are many countries that if the person comes in at the right time, and if that person gets good care following protocols that have been devised for people with COVID-19, that lowers mortality significantly. Thank you. Thank you, Doctor. The next question comes from Mariana Sanchez, BBC News, and it says,
have suggested that parts of Brazil may have achieved herd immunity, such as Manaus. Does Paho agree with this possibility? If so, is Brazil the first country to reach this point? How do you evaluate the Brazilian government response to the pandemic? Doctor Espinal podría tomar esta pregunta.
Thank you for this important question. There is no evidence that Brazil or areas of Brazil has achieved herd immunity. Achieving herd immunity, it is estimated that at least between 50 and 80% of the population needs to be immune or needs to be exposed and infected by the virus. So the survey done by a very prestigious university in Brazil found in Manaus 14% seroprevalence of antibodies. But 14% is not sufficient for herd immunity. Also, we have seen lately, because we learn every day on this virus, new evidence, for instance, surveys conducted in Spain and in Switzerland, that the seroprevalence is about 5-10%, which is not even very close to claim herd immunity, even though in countries without strict lockdown approaches like Sweden, the report back in April, May was about 7% prevalence. We need to take into account the testing, and the antibodies has their pros and their cons. It has been discussed already about rapid testing and so. So it is important in order for planning and to look at how many people are infected, but it's not really a suggestion that herd immunity has been achieved in Manaus, because it's far to reach that conclusion. Now, we're still seeing cases in Manaus. We're still seeing a high occupancy bed in Manaus also. And of course, the key issue is not the evaluation, but continuing implementing the measures that needs to be implemented. Later on, and just finish with this, we just have seen a study a couple of days ago from a famous prestigious institution in the UK, suggesting that herd immunity, the antibodies that really can destroy the virus, they're called neutralizing antibodies, are waning after 3 months, meaning that potentially herd immunity, that immunity is too short. In analogy with other coronaviruses that produce common cold. So a lot of research needs to be done, and finally, we should not. We don't recommend the approach of achieving, trying to get herd immunity, because the cost in terms of life loss will be massive, and economic costs will be also very high, and social and public health costs. Thank you.
Muchas gracias, doctor Espinal. Estamos llegando ya.
Thank you, Dr. Espinal. We're coming to the end of today's session, but we have a couple of final questions.
Mortality numbers in the region, and also Ariela Navarra from AFP, she asks if we have any projections on mortality in the region. Doctora Etienne, ¿podría tomar estas preguntas?
Thank you.
Dr. Etienne,
Thank
could
for
you
this
answer that question?
Yes, mortality is high in the region, and it is a concern for Paho. As I said before, in the last week, 64% of all new deaths in the world were reported in the region of the Americas. And this reminds us that this is a very serious disease which causes preventable deaths, and that we must do all in our power to avoid. From taking preventive measures as individuals to taking care of the most vulnerable among us so they don't get sick. The flatter the curve, the more people will survive the disease. That means we need to keep public health measures in place and reinforce them in areas that have high transmission, because that is the best way to prevent unnecessary deaths. We also need strong health services with enough hospital capacity to save as many lives as possible. We must not forget that science is evolving along with the pandemic. And every day we learn more about new resources that can actually improve treatments and care. It is also important to protect the most vulnerable among us, from the indigenous populations to the urban poor, and those who live in remote villages to those who can't access healthcare on time. An important vulnerable group consists of people with underlying health conditions like heart disease, diabetes, and obesity, who are particularly susceptible to hospitalization, to severe illness, and to death due to COVID-19. Next week in our media briefing, we will be talking more about COVID-19 and comorbidities like the ones that I've just mentioned. And I hope that you will join us next week as we begin to delve some more into COVID-19 and the comorbidities. So thank you very much. And thanks for attending this week's briefing.
Muchas gracias, doctora Etienne, y muchas gracias a todos por participar en esta sesión. Como
Thank
siempre,
you, Dr. Etienne. I thank the audience and everyone for participating. And we will post the remarks of the director, also the recordings, and you can stay in contact with us over the internet. So thank you very much for being here, and we will see you next week. Thank you.